So I've been in practice 33 years now, and I've done everything from ER to daytime practice. I love surgery. And I was a real skeptic of any kind of complementary medicine because I went to K-State 33 years ago. Until Kevin May, who I actually worked with, who was the past president of IVIS, was doing acupuncture for a wiener dog patient of mine that was down after 2 weeks with a disc. And the dog got up after the second session and was like, okay, well, obviously acupuncture is not just in your mind because wiener dog doesn't know why you're poking it with things. It got better. So that was my gateway into complementary medicine. And then I got interested in ozone. I had heard about it kind of on the periphery at some of the conferences, but I hadn't really explored it. But then my dog, Chaz, a couple years ago, got a very high-grade soft tissue sarcoma behind his scapula. And I did genetic testing on it, and it was not responsive to, would not be responsive to chemo. So removed it, did some mistletoe, CBD, Chinese herbs, and then I'm looking like, what else can I do? And found out about ozone for cancer. One of the, I don't know even how I found it, honestly, maybe it was a YouTube video, but you guys were really helpful. You got a unit to me on a Saturday so that I could start some IV ozonated saline. He got a couple of treatments of that. But it had already recurred the third time. And so I didn't get to follow through with him like I would have liked to. But not shortly after that, one of my cats one morning wouldn't eat, watery eyes, had a fever of 105.4. And I thought, well, I'm going to try this rectal ozone. It's supposed to kill everything. So I gave her an injection before I went to work in her butt and put her in the bathroom by herself with food, water, and a litter box, and came home not even 12 hours later. Temps 101.4. She ate all of her food and she looks completely normal. And that was like a big aha for me. So I was convinced, even though it didn't work completely with Chaz, and I don't put that on the ozone, it's the timing, but it was what got me the unit. So so with the Canary unit, I just started using it. Hi, Frank. Oh, she's an ozone baby too, actually. This dog had such anxiety that she was pooping in my car every day for about 2 weeks when I was doing relief work. And she I was not going to be able to keep her because you can't really drive on the highway with the dog shitting in the back of your car every day. So I had microbiome transplant from Margot, from Dr. Roman, and she had told me you really need to ozonate the bowel first to get rid of the original microbiome and then infuse the healthy specimen. Overnight, her anxiety was gone. Wow. She was completely back to normal.
Wow.
And that was a huge shock to me, that it could. I was aware that there's this idea of the gut being a second brain, but wow, that was quite the brain transplant, I would say, for Frank. So she's maintained that for it's almost been a year and a half.
Right.
With one fecal transplant.
Wow, that's amazing.
Yeah. So that's how I got started with this, and now that I'm in a permanent position instead of doing relief work, and our hospital is growing, we're getting ready to move into a new building. Like, I want to really offer the best that we can, and so we've been expanding. As I learn more and more about what ozone can do, we're offering it to more and more cases and more clients.
So tell me just briefly how you use ozone in your clinic. What does that look like on a weekly basis? How many times are you using it, and which ways are you administering it, and what are you treating?
Okay. Well, every single dental gets an ozone flush at the end of the procedure. When I do a cystotomy or unblock a cat, the bladder gets flushed with ozonated saline, and it's shocking to see the difference between what I'm used to of all this hematuria, like almost pure blood flowing through a urinary catheter after unblocking a cat. And when I flush that bladder with ozonated saline, you can barely see a trickle. The urine is clear, absolutely clear. We use it for we're getting referrals actually now from some other hospitals that are aware of this, and they have really tough cases. Like we had a dog with severe peritoneal effusion. We did, the workup to try and figure out what's going on, and it didn't really give us much direction on the fluid analysis. But when I drained that abdomen and then just infused gas, just ozone gas, the dog's quality of life improved tremendously. She stopped vomiting and she was breathing better. And we give it to all these old cats. If we're giving sub-Q fluids for an old cat with kidney problems, if I'm doing acupuncture with B12, I ozonate the B12 first before I put it in the points. So back dogs, kidney failure cats. Another thing that's been really interesting is using it after enucleation. So that's one of the awful things about taking an eye out, is there's so much blood supply. Even with a local block behind it, I still find that there's more oozing than I would like. So I just decided, why not try flushing the socket with ozonated saline, and it works. Works great. Yeah, so that really, it's and then I promise you I will get a video of this the next time we get a cat like this. But get these fat cats that can't clean their butt, and we'll bring them back for a sanitary shave. And my tech Miranda said, "Doc, you got to come look at this, because this cat's butt was on fire." And it wasn't coming to see me, so she wanted me to get a look at it because the kitty needed medication, obviously. And I said, you know what? She had already shaved it and cleaned it, and I said, let's ozonate it. So I just ozonated some water and flushed it, and the skin went from fire red to completely normal as I'm cleaning it.
Wow.
It was nuts. And then the most amazing case I'd say we've had so far is what drove us to get the bigger equipment, to get the chimp added on to our ozone generator. And that is a guy, he's a Swiss mountain dog named Augie, has a horrific aspergillus infection in the whole left side of his sinus. It's on CT scan. Referral hospital recommended opening the sinus cavity and surgical debridement to remove the colony, but expecting that he would be on antifungals for the rest of his life, I guess, and that this would just be a way of beating it back so that medication would have a better shot at it. So when we saw him, he was 15 pounds underweight, very lethargic, barely eating anything, and just copious snot coming from that side of his nose. Horrible. And we started, with the help and guidance of one of the speakers you introduced me to at the conference, Dr. John from Brazil.
Yep.
He recommended nebulizing. We did the UVB with the ozonating his blood. We did rectal. And we did it 3 days in a row. We put an IV catheter in, he came back every day, and we just kept him. And the nostril had depigmented. That's another red flag for this kind of fungal infection. The pigments come back. He gained his weight back. He's barking at the UPS guy. There's barely any snot that comes out of his nose. And I've encouraged, and the owner has bought a hummingbird so they can continue at home to do saline. They're not bubbling through olive oil, but we had another recommendation from Dr. John about using saline through a nebulizer at home. So they're doing that every day for 2 weeks, and they're doing rectal, and we're going to see how he does. Awesome. But I mean, it's been phenomenal. to see his transformation. It's
So
really amazing.
everybody except the UPS guy is happy about that, I guess.
Right.
So, well, that's all the questions I have, but do you have any final thoughts to leave people with, as far as, let's say there's people who are either just dabbling in ozone therapy or not yet started? What do you say to those people?
I would say, look at anything that's inflamed, prone to bleeding, and just put some ozone on it. We had a dog in here with hemorrhagic gastroenteritis, literally fire hose shooting bloody liquid out his ass on Thursday last week. And okay, so I go into my ER mode. Let's get an IV catheter in. I'm going to check for Clostridium, and he needs antibiotics and Serenia. And then I was like, why don't we shoot some ozone up there? So he got rectal insufflation. This is a 90-pound lab, so this was a lot of bloody poop coming out of his butt. It stopped. That was it. That was it.
Wow.
No more. No more bloody poop.
How do you explain that?
I think two things are happening. I think the ozone is killing the bacteria on contact that's creating the endotoxin. And I think that the next layer that's more dramatic is the anti-inflammatory effect it's having on the the bowel lining. That's all I can explain it for, because to me it's the same thing as cystotomy. That bladder's pissed off, it's inflamed, it's bleeding. We ozonate it, it's done. I had one guy, he's a Vietnam veteran, maybe, or Korea, I don't know. He's a veteran, old guy, and he loves his schnauzer. And this dog has had, I did a cystotomy for him, and he had had 2 previous to me. And I ozonated that dog's bladder, and he said, "Doc, this was the best one she's ever had." No blood. They usually pass clots for a day or 2. No blood at all. And we've got her on herbs and things to try and prevent it from coming back again, so, and that seems to be holding her. But that's what I'm thinking. So that's where my mind goes now. If there's something inflamed, if there's extra blood, if I'm in the middle of a mass removal and it's bleeding like crazy, we're giving rectal ozone. I'm injecting ozone around the surgical site. We're using it a lot that way too. So I guess, learning from people who have been doing it has really inspired me to try some new things, and going to conferences and listening to your summits online. And just try some stuff. Right. Yeah, that's what I would say.
Well, thank you so much for your time. I really appreciate what you have to say. And you guys there at, is it Griffith Animal Hospital?
Griffith Veterinary Hospital. Yeah, and there's Griffith. 2 in Michigan. We are the OG.
Great. Well, thank you. It's been great. Appreciate you guys, and have a great rest of your week.